Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, and you're watching my YouTube channel. Today will be the second lecture in continuation for the lecture on epilepsy and seizure disorder. We discussed that epilepsy is an abnormal discharge of neurons, which are the brain cells, which leads to uncontrolled movements of the body, which may be associated with loss of consciousness or impairment of judgment, or it could be without that, depending upon whether it's focal, simple seizures in which it could be focal with alertness being intact, or simple partial or complex partial, which is the focal seizures. In generalized seizures, there could be tonic with excessive movements of the body. There could be atonic with the loss of body. There could be clonic, in which there would be movement, abnormal movements of the body. It could be tonic-clonic, which is not only increased tone, falling back, and then clonic movements of the body with loss of consciousness, loss of bladder and bowel sphincters. And it could be absence seizures, in which you will be there will be decrease in alertness and spacing out, and the person becomes spaced out, and then he restarts his activity. The grand mal or epilepsy, which is classical tonic-clonic epilepsy, may be associated with an aura in which you will be able to see flashes of light, nausea. You may have some other symptoms. You may be able to hear or smell abnormal things, like hallucination, which is followed by generalized tonic, increased tone, falling backwards, clonic movements of the body, loss of sphincters and control, followed by a post-ictal phase in which the person is still confused, and ultimately recovery, which can range from few minutes later to up to an hour. And then myoclonic jerks, in which this certain jerk of body muscles can take place, or the Jacksonian march, in which the seizure starts from one part of the body, like a jerking movement, with secondary generalization into a grand mal seizure. Other syndromes like West syndrome, Lennox-Gastaut syndrome, those seizure disorders are in those people who have hypoxic ischemic encephalopathy or some other kind of syndromes, and they present with the seizures. The causes are variable, could be vascular, like stroke. There could be avascular, vascular malformations, decreased blood supply to the brain, or ischemia, which can happen at the time of the birth of the child with brain damage, and subsequently they will have abnormal activity of the brain. Infections like meningitis, encephalitis, torch infections can all, most of them can lead to seizure activity. Head trauma, which could be because of the direct impact to the brain, leading to the seizure, or surgery and followed by the scar tissue, like brain tumor removal, can lead subsequently lead to seizure. Causes like radiation exposure for tumors. If there's a tumor in the brain, there were radiations given, it can also lead to scarring and subsequently seizure production. AV malformation I discussed, which is cause of the vascular causes. Then metabolic. And metabolic causes, there is hypoglycemia, low glucose level, hypocalcemia, low calcium levels, and there's inborn errors of metabolism that can also cause seizures. Idiopathic, a lot of them could be unknown, which could be another reason for seizures. There could be family history of seizures, special channelopathies, which we'll be discussing in the different mechanism of treatments for the seizures. And then there are neoplasms or cancers, which could be primary or secondary, which are the metastatic tumors, but usually it's the primary brain tumors which can present as a seizure. So in my first lecture, we discussed that there is a balance. Allah has made a balance of neurons, their electrical activity. So if one neuron is activated, it propagates the message to the next neuron, just like a relay race in which the baton is transferred to the next person. Similarly, the neuronal activity is transferred from one neuron to the next one. And then there, after the message is conveyed, then there are inhibitory neurons that shut off the signal so that the signal does not continue to repeat itself. So those are the classic, and if there's an imbalance in between the excitatory and the inhibitory neurons, there's prolonged excitation, or there is a neuron which is causing excessive outbursts of neuronal signals, that can also lead to abnormal electrical activity or the seizure disorder. As far as the mechanism of these medications is concerned, there has been profound research from 1800s on how to manage seizures. In the ancient time, from the Greek and Egyptian time, they used to use the ketotic diets, and somehow ketotic diets would cause acidemia, ketone buildup, and cause cessation of seizures. They used to do trafficking, blood drainage from the brain to treat the seizures, which were kind of very, very life-threatening. Then, potassium bromide was identified in 18th century to be something which can be used, or early or mid to late 19th century, 1800 something. And then subsequently other medications were utilized to control the seizures. And in the brain, these anti-epileptic medications, they affect on different neuronal activities. So normally the action potential, the way it goes is that the electrical impulse goes from one neuron to the next, and an action potential is generated. And there is a synchronized opening and closing of the ion channels, which leads to action potential. Most importantly, there's negative charge on the inside and positive on the outside of the neurons, and there are voltage gated sodium channels, and when action potential starts, the sodium channels come in, and that also causes positive charge inside the neurons, and which further leads to opening up of the high voltage calcium channels. So the calcium also comes in. What does calcium do? It works on the granules that contain excitatory neurotransmitter glutamate. So they cause degranulation of the glutamate so that it is available. It goes into the synapse, which is the junction in between the two neurons, activates by AMPA receptors, opens up the sodium channels and the calcium channels through NMDA channels, so that the message is transferred to the next, as well as T-type calcium channels are also opened up. So calcium comes in, and the same process starts over with sodium entry, calcium entry, degranulation of activated neurotransmitter glutamate, and it goes into the next neurons. So this would be continuing unless there is an inhibitory neuron. So there is a natural mechanism of inhibitory neurons which become activated once the message is relayed, and they have the same mechanism of sodium coming in and then calcium coming in, and the inhibitory neurotransmitter is degranulated, called GABA, gamma aminobutyric acid, that goes into and acts onto the neuron to break the cyclic activity of activation by allowing the chloride ions to come in, so that it becomes negatively charged in, and it is the repolarization process that happens. And then the remaining is taken back into the neuron, the inhibitory neuron, the glutamate, once the action potential is stopped, and there are GAT1 channels, and then there is a GABA transferase enzyme, which breaks down the remaining GABA so that the impulse is stopped. So by utilizing different channels, and it is said that there are channelopathies in which some families have activated opening of certain channels, and like sodium, calcium, excessive glutamate activity, or GABA, decreased GABA activity, which can lead to seizures. So by blocking these channels, it's possible to stop the seizure continuation. And how did it happen that there was sodium channel blocking anti-seizure medicines developed, like carbamazepine, oxcarbamazepine, lamotrigine, phenytoin, topiramate, valproic acid, zonisamide. So they block the sodium, block the action potential. Then there are other medications that block the calcium channel, so that the calcium channels don't let the glutamate degranulation. And those calcium channel blocking that act on high voltage calcium channel is lamotrigine and topiramate. And then there are other second type of T-type calcium channel, valproic acid and zonisamide works on them. So there are other medications, but some actions are overlapped, like lamotrigine and topiramate can also act on the sodium and the calcium channels. So they have augmented effect so that the transmission or neurotransmission is blocked. There are certain other medications like gabapentin and pregabalin that can block the high voltage calcium channels, and they can also bind to the calcium channels. They block them, and they also can act on alpha 2 delta 1 receptors for the calcium channels, so that the calcium doesn't go in and the degranulation of the glutamate containing granules does not take place. So these are the some mechanisms. There is another one which is also calcium channel blocker, which is levetiracetam, which is speculated that it also decreases the degranulation of the glutamate by acting on SV2A protein in the walls of vesicles that contain the glutamate, so the glutamate doesn't come out and the action potential, the excitatory neurotransmitter doesn't go in. Felbamate is another medication that can act at the NMDA receptor where the calcium works, so it can block that. There are drugs that can affect on the GABA system as well. Benzodiazepine and barbiturates are the medications that cause effect by prolonging the opening of the GABA channels and permitting the influx of the negatively charged chloride ions, so that they can continue to cause repolarization and the neuron excitation is blocked. So that is a very good way by which benzodiazepine and barbiturates work. Tiagabin also acts on decreased uptake of GABA by the inhibitory neuron, so that it is available at the neurons and the excitatory activity is inhibited by the inhibitory neurotransmitter. There are other medications that can bind with GABA aminotransferase, which causes the catabolism of the GABA. So that is also blocked by medication vigabatrin. So these medications have side effects. Those side effects could range from the sodium channel blockers like carbamazepine, oxcarbamazepine can affect on vision. Phenytoin can cause gingival hyperplasia or hirsutism, increase hair on the body. Topiramate and zonisamide, they can cause weight gain. Those people who use these medications, they can have excessive weight gain. Valproic acid can cause weight loss. So those people who have problem with weight gain. Gabapentin can cause increased peripheral edema or swelling. Valproic and felbamate can cause liver toxicity, so you have to monitor liver function tests in these people. And aplastic anemia is another side effect of felbamate. So these are the common side effects of these anti-seizure medications. They can also cause sedation, fatigue, sometimes, especially with the barbiturates, topiramate, and benzodiazepines. Ataxia or diplopia or double vision can be caused by carbamazepine, oxcarbamazepine. Tremors can be caused by the valproic acid. Slow thinking, topiramate can affect that. Same as with the barbiturates and benzodiazepine. Lack of sleep could be caused by vigabatrin or felbamate. Hyperactivity in people who use benzodiazepine or benzodiazepine withdrawal. Irritability, like benzodiazepine can have irritability due to them. Mood changes. Again, the benzodiazepines, phenobarbital can affect the mood. Nausea, vomiting, like ethosuximide can cause nausea, vomiting. Headaches could be caused by lamotrigine, oxcarbamazepine. Hyponatremia because of syndrome of inappropriate ADH can be caused by carbamazepine and oxcarbamazepine. Acidosis could be caused by topiramate and zonisamide. And reduced bone mineral density, decreased calcium in the bones could be caused by the barbiturates, valproic acid, carbamazepine, and phenytoin. Phenytoin can also cause the gingival hyperplasia. The usual way of treating the seizures is that at first, most people usually have one seizure and then they may never have seizure. If they're recurrent, then it is called epilepsy. So drugs that block sodium channels can be used, like carbamazepine. Phenytoin can be used in generalized tonic-clonic, oxcarbamazepine, valproic acid. Drugs that inhibit the GABA breakdown or increase activity of the GABA, like benzodiazepine, vigabatrin, valproic acid can be used in all kinds of seizures. Drugs that block the calcium channels, like ethosuximide, are drug of choice for absence seizures. Drugs that reduce mediated by effect by excitatory amino acids like glutamate, felbamate, phenobarb, and topiramate, they can also be used in generalized tonic-clonic seizures. So these are the indications of some of these anti-seizure medications. As far as there is another thing which is called status epilepticus, which is the prolonged seizure which is greater than 30 minutes. So the 30 minutes cutoff is used as after 30 minutes of seizure, the brain can be damaged. However, the treatment should not be delayed. If it is more than 5 minutes, benzodiazepine should be given. And if it is still continuing, you can use up to 2 doses of benzodiazepine for persistent seizures. And if it is still not working, then we will use fosphenytoin, phenobarbital, or valproic acid to treat the seizure. So the patient is continuously in seizure, they're put on a side, don't put anything in the mouth, and an IV access is obtained. If not an IV access, an intraosseous bone, directly in the bone, access could be carried out. If still the seizure is continuing, then the third line of medications is utilized, which is midazolam, pentobarbital, propofol, and thiopentol. And these drugs are important because we do not want the seizure to continue, since if it continues, there will be brain damage if it is beyond 30 minutes. So most people, like children who have febrile seizures associated with fever, they have the diazepam. The rectal diazepam is given to those people, so that if the child goes into a seizure, they'll give it through rectum, and the seizure stops and the seizure does not continue. So febrile seizures are associated with fever, could be simple febrile, which could be less than 5 minutes, occur only once in 24 hours. And they are common usually between the ages 6 months to 6 years. If it is beyond 5 minutes and it is associated with more than once, then it is complex febrile seizure, and for that you will need the second benzodiazepine, and usually they can sometimes cause recurrent seizures, febrile seizures, and which could be up to 1/3 of people. Up to 60% of people may have only one seizure, and they may not have another seizure at all unless there is a reason for the seizure. There is a brain damage, brain tumor, some metabolic problem which can cause seizure. Other treatment modalities which are available, keto diet could be utilized, unknown mechanism, but it was found in Egyptians, those people who were in prisons and they were in the starvation phase and they had ketosis, and the seizures responded to the stage of starvation, and that is utilized these days as well. Surgery is a very important modality. Before surgery, I would say vagal nerve stimulator, which increases the output of inhibitory vagus nerve, and it just fires as soon as the seizure starts. So people with West syndrome, Lennox-Gastaut syndrome, who have recurrent seizures, they can be placed with the vagal nerve stimulator. ACTH or steroids can be used in myoclonic epilepsy, which will be able to finish or stop those kinds of seizures. Surgery could be utilized by identifying by leads by EEG, which is used to diagnose the type of epilepsy, where is the abnormal focus in the brain. They can identify during the surgery, they can identify, oh, these waves are coming from temporal lobe, frontal lobe, or occipital lobe. So the seizure activity will indicate the focus from where the abnormal pulses or abnormal electric currents are coming in. So that part of the brain is removed. Once you remove that part of the brain, then what happens is the seizures, they end. So in a nutshell, there are multiple modalities. Sometimes some people respond to only one seizure medication. Some people need 2 seizure medications to augment. And usually if the child is seizure free for up to 2 years, then there is a case of gradually tapering off. The child does not have any seizures, so then we try to try to taper off the anti-seizure medicine. If you want to stop one seizure medicine, don't stop abruptly. It is tapered off and the second medicine is started, so that by the end of tapering, the second seizure medicine has already gained the therapeutic index, and half-life has already entered into the therapeutic dose, and gradually the dose is increased. Sometimes the levels of anti-seizure medications like valproic acid are monitored so that they don't go into toxicity range. I hope this talk or these brief review of seizures, causes of seizures, seizure medications will be useful for you. Please give me your feedback and let me know if there is any other topic that you want me to make video on. May Allah take care of all of us. Sallallahu alayhi wa alihi wa sahbihi wa sallamu taslima. Assalamu alaikum.